The problem that we're facing is that children in a developing country setting often turn up with a bit of a fever, a bit of a cough. It might just be a common cold that will go away by itself, but it might be something really dangerous like malaria or pneumonia. And most often the health workers in the very small clinics don't have any way of testing appropriately. They don't have a chest x-ray machine, for example. The best way to distinguish whether the child has only a cold or something more serious, such as pneumonia, is how fast they're breathing. So thresholds have been established. If the child is breathing fast, fast for their age, then they've probably got pneumonia or something else serious and that they would benefit from an antibiotic. The problem is that the health workers have to count how fast the child is breathing. And that's what we've tried to address with this app that we've built, is to make it easy for the health workers to count how fast children are breathing. There are 3 cut-off thresholds depending on the child's age. So the first screen asks the health worker to just choose which age group the child is in. So if they were, say, 1 to 5 years, then it says just press any of the number buttons once each time you see the child breathing. And then after that, the health worker doesn't have to be counting. And so they can use this even with a fair bit of distracting noise and so on around them, because they just have to remember to press the button each time the child breathes. Now, I'll deliberately press it as though it was a sick child. You can see after 10 breaths it begins interpreting the estimate for us. But when we get to 20 breaths, then it goes red if the count is fast breathing, and it will go green if the count is not fast breathing. So we found that after 20 breaths we get pretty much the same answer as we would get if we kept going for a full minute. So I would be happy at this point to decide, yes, this child has fast breathing, so I should treat them as though they have pneumonia. After 20 breaths, if it's not fast breathing and the screen has gone green, then I'd be quite happy not to treat this child as pneumonia. Now, after a full minute, it summarises everything for us, and it tells us what those estimates were and then what the actual 1 minute count was, and interprets it as fast breathing or not fast breathing. So the problem can go both ways. If the right diagnosis is not made, there's a real risk that a child who's got quite a severe illness will get sent home without appropriate treatment, and they could even die. But the opposite also applies, that if the health workers follow the natural inclination to give every child coverage for every different possible diagnosis, then they use up their drugs really quickly. And it's a very common complaint that the health service or the health facility is using up the drug supply well before they're due to get another replacement supply. So we're trying to do 2 things. We're trying to focus the treatment better so the quite sick child doesn't get missed, but at the same time they don't waste what are really very precious and expensive drugs.